Do you know that every single day in the United States, over 27 million people go without health insurance, leaving them one accident or illness away from financial ruin? Imagine waking up to a routine doctor's visit that spirals into a $100,000 hospital bill you go and pay it as. Not a nightmare scenario. It's the reality for millions. Health insurance isn't just a policy. It's your lifeline in a country where medical costs can bankrupt you faster than any other crisis. Let's dive into why health insurance is absolutely essential in the USA at its core. The American healthcare system is built on a fee-for-service model, where providers charge exorbitant rates for everything from routine checkups to emergency surgeries. Without insurance, a simple appendectomy can cost upwards of $33,000. According to data from the Healthcare Cost Institute, insurance acts as a shield, negotiating lower rates with hospitals and doctors, covering 70 to 90% of those costs, depending on your plan. It spreads the risk across millions of policyholders, making sure that when disaster strikes, you're not footing the entire bill alone. Consider the story of Sarah Thompson, a 42-year-old teacher from Ohio. In 2022, she slipped on ice outside her school, fracturing her hip. Without insurance at the time, she'd lost her job amid pandemic layoffs or surgery. Beyond shielding your wallet, health insurance promotes preventive care, which keeps small issues from becoming catastrophes. Plans mandated by the Affordable Care Act (ACA) cover annual wellness visits, vaccinations, mammograms, colonoscopies, and more at no extra cost. This early detection saves lives. Studies from the CDC show that insured individuals are 30% more likely to get screened for cancers, like breast and colorectal, leading to earlier treatment and higher survival rates. Take John Ramirez, a construction worker in Texas. His insurance-covered annual checkup in 2023 caught high blood pressure early. Simple medication changes prevented a heart attack that could have sidelined him permanently. Uninsured, he'd have ignored the subtle symptoms until it was too late, facing bills in the hundreds of thousands. In the USA, the absence of a universal healthcare system means employer-sponsored insurance is the gold standard for most working adults, covering about 155 million people. These plans often include dental, vision, and prescription drug coverage, with employers picking up half or more of the premiums. But what if you lose your job? COBRA lets you keep that coverage for up to 18 months, though it's pricey. Marketplace plans via healthcare, Gov step in for individuals, offering subsidies based on income someone earning. $50,000 might qualify for $400 monthly premium tax credits, slashing costs dramatically. Medicaid expansions in 40 states now cover low-income adults up to 138% of the federal poverty level, including over 20 million who might otherwise go without. Real-world examples hammer home the stakes. During the COVID-19 pandemic, uninsured rates spiked temporarily, but vaccines and testing were free regardless, yet hospital stays weren't. Maria Gonzalez, a freelance graphic designer in Florida, contracted the virus in 2021 without coverage. Her 10-day ICU stay cost $127,000. She negotiated it down to $40,000 but still drained her savings and retirement. Insured peers in similar situations paid averages of $10,000 out of pocket per Fair Health data. Insurance also unlocks specialized care. Think chemotherapy for cancer, which runs $10,000, $150,000 per cycle uninsured. The American Cancer Society notes that insured patients start treatment 20% faster, boasting 5-year survival rates by up to 10%. Mental health is another critical area where insurance shines. With rising anxiety and depression post-pandemic, plans now cover therapy sessions and psychiatric meds under parity laws. Without it, a single therapy hour averages $120, and inpatient care can hit $20,000 weekly. Recall the case of David Lee, a veteran in California. Struggling with PTSD after his service, his VA coverage bolstered by supplemental insurance provided 52 therapy sessions in 2024, helping him return to work. Uninsured veterans often wait months or forgo care, leading to higher suicide rates, as reported by the VA itself. For Familias Insurances EG, children's coverage through CHIP or family plans ensures kids get braces, asthma inhalers, or orthopedics without parents choosing between rent and health. A 2024 study in Health Affairs found that insured kids miss 50% fewer school days due to illness. Pregnant women benefit too. Prenatal care covered by insurance reduces preterm births by 14%, saving newborns from NICU stays that cost $5,000 per day uninsured. Navigating options can feel overwhelming, but resources like healthcare, Gov's Plan Finder simplify it. Critics argue insurance premiums are skyrocketing, averaging $7,739 for single coverage in 2025, per the Kaiser Family Foundation. Yet, without it, costs explode exponentially. Short-term plans or health-sharing ministries tempt some, but they often exclude pre-existing conditions, leaving gaps. The ACS protections ban that discrimination, ensuring 135 million Americans with chronic illnesses aren't shut out. Prescription drugs highlight the urgency. In the U.S., EpiPens cost $600 without insurance versus $100 abroad. Medicare Part D or employer plans cap costs at $2,000 annually starting 2025 under the Inflation Reduction Act. For Lisa, a retiree in New York, this cap meant affording her rheumatoid arthritis meds without skipping doses, avoiding joint damage that could require $50,000 surgeries. Emergencies don't discriminate. Car crashes, strokes, falls. ER visits average $2,400 uninsured. With insurance, copays hover at $300. The No Surprises Act protects against out-of-network billing, but only insured patients fully benefit. Mike Patel's 2024 motorcycle accident in Arizona racked up $250,000 in helicopter and trauma care. His policy covered 80%, sparing his family devastation. Health insurance in the USA isn't a luxury. It's survival gear in a high-stakes system. From preventing bankruptcies like Sarah's to enabling early detections like John's, it empowers you to thrive, not just survive. Don't wait for the do you know moment to hit home. Enroll today via your employer, marketplace, or Medicaid. Your health, finances, and peace of mind depend on it. Take control now. One policy could rewrite your story forever.